First of all, in the world we're living in now, most primary care doctors have thousands of patients, 2,000 or 3,000 patients. And with that many patients, it's very hard to give individual personalized care. The reason they have to have so many patients is that they're running on a hamster wheel because of the insurance system. Now, concierge medicine or direct practice, which we kind of prefer the term direct practice, limits the numbers of patients in the practice to a few hundred. Because of that, I am able to see each of those patients once a year for a detailed 1 to 2 hour comprehensive medical exam and create a wellness plan for them and work with them on improving their health. Whereas if you have 2,000 or 3,000 patients, it's not possible to do that. And in addition, because those patients are so well cared for, they rarely need hospitalization, they rarely need more serious medical care because we do a lot of preventive medicine. Further, when you're in my practice, you have my cell phone, you have my home phone, you have my pager number, and you're free and encouraged to call me any time of the day or night, 24/7, 365, if you have any medical issue or problem. And that's a promise I make to my patients that I'll be available. In fact, I joke with my patients that the only time they won't be able to reach me is when I'm under general anesthesia. So that's the main reason you want to be in the practice. But the other reason that I'm trying to emphasize a lot now is that the ethics of medicine is really changing in the United States. And the reason it's changing is because of the insurance system. The insurance system is asking primary care doctors to be gatekeepers and to try to control what is done for patients, to keep the costs down, to make sure that everybody gets the same kind of care. And doctors are being contractually obliged to do that under various kinds of insurance plans. And many doctors are very uncomfortable with that new ethic because our old ethic was to always do the very best we could for every single patient that we were dealing with and give the best advice we possibly could, find the very best care for that individual patient that we possibly could. But the new ethic that an awful lot of medical societies and insurance companies are adopting is that we should be trying to take care of a population of patients and trying to use a certain fixed amount of dollars to spread the care around so that we get the best care for a large group of patients. And that usually does mean limiting specific care for an individual or perhaps not offering something that could be beneficial to that patient. Concierge medicine, direct practice, is the last refuge, really, and I think a growing refuge for doctors who don't believe in that new ethic, who believe that our role is and should and must continue to be, when we're in a room with a patient, to do the very best we can for each of those patients. And in the rest of the medical world we're dealing with in the United States right now, promoted by government and promoted by the insurance industry and employers, that ethic is changing, and we want to keep the old ethic the way it is so that you get the best care you can and we give you the best advice you can. The public health ethic should not come into the private medical office. That ethic, that public health ethic where you're trying to decide how to spend government dollars the best for getting everyone immunized and making sure the water's clean and the air is clean, that's fine for governments. But it doesn't work on an individual basis for patients and doctors in an exam room. And it shouldn't be that way for you and me, and it won't be.